In this video, we're going to teach you how to walk a patient with tethers, utilizing safety and minimizing tethers as well. It is important to minimize as many tethers as possible, such as saline locking an IV, which we have already done down there on his hand. Excellent. And he's hooked up to oxygen, so it's important to know how much oxygen he is on, and so you can get a portable oxygen tank, which is behind Alyss. And so you can hook them up to the same amount of liters. They possibly may need more liters depending on their O2 saturations. After you've done that, it is also important to know if they have any extra tethers. So anything such as a Foley bag, which is attached to the patient, you will definitely want to make sure you take that with them. And also make sure that you're creating a proper height, because this can be a risk for infection. I also have sequential compression devices on his legs here, and that is important to take those off, as those can be a fall hazard. He also has no-slip socks on, which create a nice grip on the ground, just an extra fall safety measure. Also important to make sure the bed is in a low lock position, so while sitting on the edge of the bed doesn't shoot out from underneath him. It's also important to know the level of consciousness of your patient, medications that possibly cause extra fall risks, and to also know how many people you may need. Sometimes you may be able to do it with one person, you may need an extra person to help you carry oxygen. It just depends on the stability of your patient. It never hurts to have more people to ensure safety. Also make sure that you have your cane available or a walker. Also using a gait belt around the patient we will demonstrate is useful as well. Lastly, make sure to communicate with your patient so that they know the plan and you know the plan. Have a clear path, as well as make sure it's well lighted, free of obstacles. So this will just ensure safety as well. Now we are going to go ahead. It's also a good idea to notify your nurse so you can pre-med the patient, especially if they're in a lot of pain. Alyss is going to demonstrate taking some of these tethers away and going to show how easy it is to ambulate Dan without the risk of tethers. So Alyss is just simply taking off the SEDs. You could also unvelcro the SEDs and stick the plastic piece up into the SED as well to get it out of the way. Just going to go ahead and set up her walker. She's going to note the amount of liters of oxygen he's on and put it on to the portable oxygen tank. And then we're just going to assess Dan. Dan is aware, he's fully conscious, he's alert and oriented to self, he's ready to go here. So we're going to communicate a plan. We're just going to scoot to the edge of the bed, be mindful of the catheter. You may want to pick the catheter up off of the thing, so you want to pull that out. That could cause trauma to our patient, so we definitely don't want that. So keeping it below the patient, continuing drainage. As soon as oxygen is hooked up, now before we get up, we're going to sit there for a second. Some patients may cause hypotension, so it's important to sit on the edge of the bed. He's going to unhook the oxygen, make sure that's ready. Once again, our IV is saline locked. That's one less tether. We kind of have everything on one side of the patient, which is also helpful, and out in front, so we're not getting anything confused or tripping over anything as well. Now we're just going to put a gait belt around Dan's waist just for extra safety. It never hurts. And as you can see, everything is ready. The walker is out in front of him. We have all of our supplies. We have a clear path. We know where we're going, so it's easy to execute our plan. All right, that's nice and tight around Dan's waist there. And now we'll get you to put your feet in front of you, Dan. So it's important to instruct the patient. All of our tethers are out of the way. We have the Foley on the lower part, so it's not creating any backflow into the reservoir for infection. And on the count of 3, you're going to tell him to use his strength and stand up.
1, 2, 3.
Excellent. And now while Dan is pushing the walker, Alyss is just going to make sure all tethers are out of the way. She's going to push the oxygen tank. And our patient is just going to do such a swimmingly well job. He's going to ambulate.
Gotta make sure that we have a backup plan. wheelchair, just in case.
So in the scenario if Dan were to get tired, we would have a wheelchair that he could sit down on and take a break. Excellent. And now he would just go back, hopefully go back to bed after his little cruise. It's also a good idea sometimes if your patient is on a high level of oxygen to carry a pulse ox with you. So if they desat, you can know to turn up liters, maybe sit down, call for help. Do whatever you need to do to ensure patient safety. Look at Dan go. She's doing a great job. Lisa's doing a great job. All right. Good distance. You can go ahead and sit back down. Excellent. That's complete our video, and now you how to know safely walk with Tethers.